come from Malawi. In 1995, 29 years ago, I was involved in a road traffic accident. So sustained several fractures from my neck, spine, and my leg. So on my leg, I fractured my knee. I was treated in Malawi for several months. I was in traction and several operations were done. It did not help. And after physiotherapy, I started walking. So I had walked for several years, so my knee got stiff, and just before coming here, I used to be falling down. When I came to Manipal hospital, I was reviewed by Dr. Sunil G Kini, who suggested that we do a robotic total knee replacement.
When I saw her, I found out that her knee was worn, and also her range of movements was painful and restricted to a few degrees only. We did a CT scan which found that there was extensive bone loss because of the trauma and the metalwork in the distal part of the thigh bone, or the distal femur, what we call. Her inflammatory markers were also raised, the ESR and CRP, which indicated that there may be a low-grade infection. So we counseled her that she may need a two-stage surgery. The first stage surgery, wherein we would do a cleanup of the knee, followed by the definitive surgery 6 weeks back. So after the first stage and the cleanup was done, we started on IV antibiotics. We waited for about 4 weeks till the inflammatory markers settled and was normal, and then we went with the second stage. Since there was extensive bone loss of the distal part of the thigh bone, a conventional knee replacement would not be possible. So in this case, we used an implant which we call as a distal femur replacement, which includes a metal work that shapes up to the distal part of the femur, or the distal femoral condyle. Along with that, a hinged knee was used, and the surgery went on successfully well.
Now that I'm going back, I'm grateful. When I meet others at home that have same problems, I'm an ambassador of Manipal Hospital. I will encourage them to try their luck here, be treated, and they will feel better. Here they have everything to assist a person on every problem. It's nothing to them, it's just like a cup of tea.